A tooth is like a fountain. Each is a complicated living structure that requires nutrition, hydration, and internal cleansing. To that end, blood vessels, lymph, and nerves enter into the hollowed pulp chamber through its base. From the pulp chamber, highlighted in red, run miles of microscopic tubules, about 3 miles in a front tooth and perhaps more than double the miles in back molars. It is through these tubules that nerves and lymph flow, bringing minerals and nutrients to keep a tooth alive, strong, and flexible. Examining this image more closely, the dark filaments running diagonally downwards from the upper right-hand corner are bacteria invading these tubules. 12 to 13 microbes can fit side by side into each tubule, but the tubules are so small not even one white blood cell can enter to mop up the microbial invasion. Even if they could, some bacteria have mechanisms to foil these soldier cells. Whether bacteria enter the pulp through tubules from tooth decay or the pockets of gum disease, they eventually kill the pulp and the tooth abscesses. Usually, but not always, the tooth becomes painful and dies. It is at this point that traditional dentists recommend embalming the tooth with a root canal. They drill out an access to the pulp, sever the nerves in the pulp from their extensions into the microscopic tubules, remove them, and then with a series of ever larger files, they file away as much of the edges of the empty chamber as they can. Some use bleach, a laser, biocalyx, also known as endocal, or ozone in an attempt to sterilize the canal. After trying to disinfect a tooth, the main pulp channels are filled with an inert material. The ideal is to disinfect and fill to the base or apex of the tooth, but as you can see in this case, that doesn't always happen, and sometimes the canal is overfilled. Shrinkage of the material as it cools, underfilling, or overfilling are just 3 ways root canals obviously fail. It is an oversimplification that pulp chambers are always straight, that there is always just one per root, and that cleaning or sealing the miles of tubules can be overlooked. Straight A to B thinking works no better than a straight line laser or a straight file. The thin, dark lining around each tooth is called the periodontal ligament. It is the shock absorber for each tooth during chewing. Unfortunately, chewing can pump oral microbes, and worse, their toxic wastes that remain within the tubules, the ligament, and the infected bone surrounding the dead tooth, into the blood vessels in the area and the mouth. From here, they can travel virtually anywhere in the body, like joints, organs, and the brain. Dr. Boyd Haley, Professor Emeritus of Chemistry at the University of Kentucky, discovered that root canal toxins in the parts per billion range inactivate critical enzymes that quarterback every activity of our bodies. They inactivate or impair hormones and neurological activity while encouraging autoimmune issues. Haley is an expert on Alzheimer's disease and discovered that 2 important proteins are found in low concentrations in all those with Alzheimer's disease compared to those without it. Root canal teeth produce a waste product that annihilates these proteins 5 times faster than mercury does. A milder example, if you have mercury fillings, a root canal, and digestive problems, know that anaerobic bacteria in root canal teeth create poisonous hydrogen sulfide and methyl mercaptan gases that, when combined with mercury and other heavy metals, destroy digestive enzyme activity, eventually leading to a wide range of gastrointestinal problems. Some call root canal teeth more toxic than the botulinum toxin. fact, unless a dentist uses ozone gas, he or she cannot sterilize a tooth with its miles of tubules. And because the perimeter of a tooth cannot be sealed, even with ozone, it is uncertain how long these tubules, or the bony socket anchoring it, stay sterile in a living environment. Most biological dentists suggest a range of 1 month to maybe a year. Sometimes the body tries to quarantine an infected tooth by forming a highly calcified bony wall around a root canal tooth that makes it look as though it is healing, when in fact the opposite is true. This is called condensing osteitis, and it looks super white on an X-ray. It can easily mask abscesses. A dense bony wall encasing a brittle dehydrated tooth makes properly extracting root canal teeth an enormous yet critical challenge if one is trying to regain health and has decided to remove all root canal teeth. Improperly done, they lead to equally poisonous jawbone cavitations like this one. Cavitations, which is slang for osteonecrosis, are areas of somewhat liquefied dead jawbone colonized by anaerobic bacteria and their waste products. Trauma, smoking, and diabetes can contribute to their formation, but improper extractions and clotting or abnormalities are the biggest reason they form. Their toxicity is on a par with root canals, so it makes sense to also clean up jawbone cavitations when removing root canal teeth. Is it odd that cavitations, often resulting from dental procedures, are not recognized by traditional dentistry? Think about it. As a profession, we do better when we can point a finger to jawbone death arising from pharmaceutical drugs, like bisphosphonates, which are prescribed for osteoporosis or bone cancer, rather than pointing to our own profession. Testing a young oral surgeon, highly respected in traditional dental circles for his skill and brilliance, I recently queried him about them. He rolled his eyes and scoffed. Of course cavitations exist. To help avoid cavitations after an extraction, a dentist must follow through as though he were finishing a cavitation surgery. He or she must thoroughly remove the ligament that surrounds the tooth, something most don't do. Additionally, at least 1 millimeter of bone should be carefully removed with a slow-speed drill and copious water spray. If there is condensing osteitis, as with this tooth, it too must be carefully removed. There are numerous additional adjuncts biological dentists use, such as irrigating the socket with an ozonated 5% concentration of magnesium chloride, ozone gassing the socket, and then filling with a biocompatible socket putty to control clotting problems. Many biological dentists will offer vitamin C, IV, and acupuncture or acupressure following the procedure to help clear meridians. Immune system support is always recommended. And of course it works both ways. Getting rid of root canals, cavitations, and heavy metals surely lightens the immune system's load and is a good way to start a person's journey back to health. Root canal roulette? You decide.